doctor, or are you going to be, you know, an attorney or something to that sort. So, you know, everybody had their sight of me being a doctor. And when I started applying, when I applied to GW actually, and she said, "Oh my God, I think what you want to do, you will be better suited, you know, to work in public health." I said, "Okay, well, I'll try it." And then during that time, I just did physicians and basically see what happens. And so I basically went and got my MPH in public health. And what I will say is like the rest is kind of history. I did my MPH in health policy. And after that, and I had a minor in epidemiology. And when I tell you I am a true generalist, as you call public health professional, that's really, that's what I am. Because when I finished, I actually got a job with the Maryland State Health Department working in epidemiology, as an epidemiologist working in immunization. I did that for a little bit. And then I decided, well, you know, I wanted to work in global health. And I transferred to the University of Maryland and started working with the School of Medicine, traveling to Africa, doing HIV/AIDS work, building capacity in Nigeria, which was really awesome. And eventually life changed. I got married and etc. And I transitioned to doing cancer research, still at the University of Maryland. And it was really good at that point. I oversee a cancer research project from NIH that looked at patient navigation. And we were focused on colorectal cancer as well as breast cancer. And that really was awesome. It really allowed me the opportunity to work with people and be in the field and doing outreach work. And as I was doing that, you know, I really enjoyed management. I really enjoyed leading, and I started really working on my MBA in management at that point. And it was around that time as well when I finished. The recession was going on in 2008, and nobody was hiring. So if you want to do consulting work, whatever you wanted to do, you couldn't do it. And I said, well, it's okay. I want to work at, you know, health outcomes research. And at that point, the CDC and the federal government, they were very precise about who they were giving grants. If you didn't have an evaluation component and so on, they didn't really, that they were changing really the game on how they did it. So I started doing outcome research and doing evaluation work back at the Maryland State Health Department for chronic diseases. And it was at that point, during that whole time, I keep, you know, nutrition is always in the back of my head. It's always there when you start traveling the world and different, you know, different countries, you're just kind of looking like, what is that link? And it was when I was there for about a decade, almost a decade, that I realized I worked with oral health, I worked with chronic diseases, and I started going, I was a senior epidemiologist at that point. I started doing some site visits in Maryland. And I was just going to the clinics, and I was just realizing the people that were doing some of the outreach, some of the education, they didn't look like the people that, you know, that they were serving, nor did they understand. There wasn't any cultural aspect to it. They couldn't relate. It was just very textbook. And it keeps coming back. And I would just keep writing articles and writing reports for the state. And I kept going to conferences, and my director at that point, the director that was over at the state who was over the program, he said, well, let's do it. You know, if you want to go to those to conferences to learn, to get CEs, we do it. And so I decided to go back to school at that point to become a dietitian. And because when you're realizing that the people most affected by some of the chronic illnesses that we have in the country, and they are made fun of if they're affected by obesity, if they're affected by certain disease, that is really beyond their control to some extent. But people can't relate to that, you know. And so I wanted to go back to my community, and I started doing some research. Only 3% of dietitians are Black or BIPOC, and that's including students as well. And it wasn't something that I wanted. You know, I wanted to be part of the solution. And I realized, being of Haitian descent, and what really drove it home for me was the fact that being from Haiti, and you always hear all these stories, you know, ridiculous stories from a nutrition perspective about Haiti, they don't have enough to eat. But for me, my family has longevity. You know, my grandmother lived until 97, my grandfather on both sides. My grandmother's sister lived until just recently passed away at 102, 103. So I couldn't figure it out, you know, why they live in the poorest country, but they're really doing well. And, you know, when I really looked at it, it's like they eat fresh foods. They'll eat from the land in which that, you know, and they live, they inhabitate. Everything was locally, I think everything was sustainably produced. There wasn't a lot of that, all the issues we have in westernized countries like that. So I was like, okay, there's something there. And let's try to go back to basics. And really the rest have been history. And, you know, I was always looking, I love academia, obviously, because I went back to school way too many times, as you can see. But I love academia, and I was really looking at the center, and I love what they did. They didn't really only focus on chronic illnesses and so on, but they focused on the gamut, right? They focused on the food system as a whole, you know, and I really, really enjoyed that. And so when I got this job as a program officer, I really you know, I work specifically, I look at the connection between diet, people, and the planet, you know, but specifically half of my time is focused on Meatless Monday, which basically it's a program, you know, it's a campaign that started, it really managed itself, but Johns Hopkins, the center provides a technical assistance to that program. So that means we are the science advisory. They can't really say anything or put anything out there without it being backed by science. So that is what we do. And so a good amount of my work deal with doing a lot of literature reviews, a lot of like nutrition education, a lot of editing, a lot of, you know, if you want to talk about plant-based, how it relates to sustainability, well, you can't say that. Here's the data. If you want to talk about, you know, protein, sustainable, how do you get people from eating, you know, to eating less meat, and how do you make that connection really, you know, between, you know, from animal product to more sustainable, you know, plant-based eating. So it's just a lot of that. And we have a lot of evidence that talks about healthy, sustainable diets and how it protects public health and the planet, you know, the planet itself specifically, or the climate. So that's really what a lot of what we do. We talked about that. We talk about that connection to that link to public health. We talk about you know, the link, you know, sustainability as it relates to where does your meat come from, the whole IFAP, you know, we deal with that as well. We just do so much. We really, really, really do quite a bit. And the one thing that I'm working on currently is myself and my counterpart, Becky, we're working on a dairy paper, which we focus a lot of individuals right now are using plant-based milk. You know, from a nutritional standpoint and from an environmental standpoint, what's best for you? What is the consensus? What is the data is saying? So, you know, I do a lot of I do for the center focus on that. And as well, some of the things too I'm starting to work on at the center is that whole policy aspect, right? CLF, we are an academic center. We are in the School of Public Health. So the whole applied science and system thinking to help build equitable, resilient food system, that's what we do. We have food policy network that is exactly building their capacity, working, how can we support a policy to bring about change in, you know, certain community, and investing in communities of color, investing in rural populations. So that's part of what I do there. Recently, actually, I am a faculty at Howard University, again, targeting people to, how do I provide resources? How do I really feed the soul of others, transfer that knowledge? So I started teaching at Howard University, teaching nutrition to dietetic students. And so that's been very fulfilling. And just because I love the aspect of clinic, you know, sometimes when I'm able to, when I have the time, I work at the nursing home rehabilitation center. And I always say, as a dietitian, if you want clinical experience, if you want to see it all, there are long-term care facilities, it is all there. It really gives you a different perspective. So my path is different. My path is something that works for me, something I believe in. I get to do the, you know, the public aspect of it. I get to teach. I get to do amazing things like this and talk to you and fellowship with Mary and the team there, and work with other universities. I get to work with the Culinary Institute, CIA of the Arts. I present there. We have membership there. You know, again, writing papers. We are involved in so many things. But what's amazing about what we do at the center, what I get to do, I get to really work with the food system as a whole. And I get to focus on really, for me, what's more important to me is identifying the inequities that exist in our system and look at the guidelines, which are practical, and really determine what are the determinants that are causing. It's not only the social determinants of health. There are determinants of the determinants, and what are those, and how do we target those determinants so we can bring about really outcomes where we can have equitable, access to health, equitable access to fruits and vegetables, to everything for all, really for all people. Yeah.
Thank you, Daphne. You have lived like 40 lives in one life. So much has happened in your life to get you to where you are today. And thank you for sharing such a personal story, and to really bringing in that equity piece, the accessibility piece, the racial equity piece. It's so important that that is considered to be this really integral part of what sustainability in the food system and in general in healthcare means as well. So thank you for sharing that. And I know we're going to come back to you and ask you a lot of questions about your work with Meatless Mondays and Center for a Livable Future and policy, because boy, there's so many avenues to getting a more sustainable food system. And I'm going to put in a plug for Johns Hopkins University's our Center for Livable Future's amazing course on Coursera as well, about sustainable diets and about intro to the food system. I use their textbooks as well in the classes that I teach, and I can't say enough about Ronnie Neff, who's the editor of that textbook and also as a presenter. Amazing. So if you're looking for some valuable teachings that are free, they are available to you. So thank you so much, Daphne. We'll be back in touch with you, and I'm going to introduce the next person. Great. Our last speaker today, our last panelist, is Huda Khalif. She is the director at Thrive Consultancy. She received her Master of Sustainability Solutions degree, as well as her Bachelor of Arts in Sustainability and Psychology from ASU. I think there's somebody else from ASU out there as well. She's worked on collaborative projects with communities globally to build socioeconomic resilience, well-being, and food sovereignty through sustainability principles and practices. Welcome, Huda. I will let you take it away.
All right, thank you so much, Mary. I'm so honored to be able to present after these amazing changemakers. Good evening, everyone. My name is Huda, and I'm a sustainability consultant transitioning to co-director at Thrive Consultancy. And today I'd like to share with you the work that we're doing at Thrive, and then go back in time a little to share part of my story about how I came to Thrive and how Thrive came to be.
Huda, I don't mean to interrupt you, but your screen sharing, it's not on anything right now.
Oh, okay. Let's see. Can you see my screen now?
Yes, perfect.
Okay. And you can still see it, correct?
Yeah, it's just, I think, taking a second to load over. So if you go maybe back real quick and then go, yeah, perfect.
Okay, give me 1 second. I think I can fix this real quick. Sorry about that.
Not a problem. We just want to make sure everyone can see your beautiful information.
Yeah, thank you for letting me know. It should just be 1 moment.
And while you're doing that, we can also put in some of Huda's information about Thrive Consultancy and other ways to connect with her. I'm happy to do that right now while you're getting that together. And I just want to say it's so amazing to think about the variety of panelists that we have. We've had a researcher and professor, we have someone working in public health and policy, and now we have a consultant working in a different realm and not a dietitian. So it's just amazing the different avenues, again, that we have towards sustainability in our food systems and climate change. All right, Huda, are you good to go, or you need another moment?
I might need just 1 little moment. As soon as I tried to reload it, the internet just went weird on me, but I think I should be good in just a bit. Okay.
And if it doesn't load properly for you, you're also welcome to send it to me or Bretta, and we can share it as well.
Okay, does that look good right now?
It's still black right now. It did work before though, so we know that this actually does work. Hey, I see. Oh, there. Yeah, we're seeing it. It's just very small.
Okay. Oh. I think I lost it 1 more time. I'm so sorry about that.
No worries. And remember to keep those questions coming into the chat. We've got a few questions here, but if you would like to know other specific detail about the work that Daphne's doing, that Janan is doing, or that Huda is doing, please make sure you're putting those in the chat so we are seeing them and I can ask them when we all get back together here.
I'm gonna try one more thing.
Okay.
Hopefully this should work. Okay, this should be good now. I'm going to try and present one more time. All right.
Perfect.
Awesome. Sorry about that. Okay, so I'm just gonna jump right in. So we're an Arizona Benefit Corporation providing development services for businesses that want to put their workers, their community, and the environment at the forefront while still being economically successful. And at Thrive, we really envision building a more sustainable economy in Arizona. You might ask, why advance sustainability by focusing on the economy? And that's because sustainable economies are really at the heart of thriving, resilient communities and community wealth building. And in Arizona, we currently focus on growing out our sustainable food economy specifically, as food apartheid and access to healthy food is a pressing issue despite the abundance of plants that can grow in the Sonoran Desert here. So in Arizona, while we've had the legislation in place since 2016 for the cooperative business model, which is one of the sustainable business models, it's yet to be activated on a large scale. There are currently only 2 for-profit cooperatives in the state that have been incorporated under this new legislation, one of which we've advised and they incorporated last year, and another one of which we walked through the legal review and incorporation process, and they just incorporated as a cooperative a few weeks back, which was a highlight for us at Thrive. So a little bit more about what we offer. In order to attain these goals, we currently offer a few programs and services, and we look to expand these as we move forward. So we offer a free City of Phoenix sponsored 10-week sustainable cooperative food business training program that really aims to build capacity for either existing businesses or aspiring entrepreneurs for cooperative and sustainable business planning. And what is a cooperative business, you might ask? It's a sustainable business model that employs a co-ownership structure, and it abides by 7 principles, which include democratic member control, collaboration amongst cooperatives, and concern for community. We also provide one-on-one cooperative business support at Thrive, such as most recently when we supported the Food Forest Cooperative to legally incorporate as a cooperative in Arizona. And that's a picture right there in the middle of that moment captured. And finally, we know that capacity building for businesses is only one piece of building a more sustainable economy in Arizona. So we engage in ecosystem development workshops in which we engage with all the players of the economy, including financiers, corporation commissions, to create a more holistic environment in which sustainable emerging business owners can thrive once going through our programs. So what brought Thrive to the point we are at now, and what brought me to Thrive? These 2 stories at some point intertwined, so I'll share a few highlights from these with you all. So personally, I grew up witnessing life in a few different countries, hearing some of my father's stories of growing up in a civil war in Lebanon, and brought along with me a passion to create long-term change in my community. My first highlight that I'll share with you took place during my Master of Sustainability Solutions program, where I met Hannah, now the founder of Thrive, in a course that we took on disaster response through sustainability in Indonesia, where we worked together intensely for 1 semester, and we traveled to Indonesia to apply our sustainability project under the guidance of our professor and by the side of our dear friend, both who were Indonesian natives. And you can see a picture of that in the bottom left corner. The second highlight I share is of my own 2-year culminating experience project, which focused on increasing the socioeconomic resilience of Utuado farmers. And Utuado is a municipality in Puerto Rico, through agritourism. So that yielded a farmers learning community program, which is a peer-based learning program for farmers looking to build their own cooperative agritourism enterprises. This program is now a part of Thrive, and we look to launch it in the coming year. And on the top right corner of my slide, you'll see a picture of me with some of our fellow collaborators down in Puerto Rico. And finally, I'd be remiss not to mention amidst all of this that one of my and Hannah's most formative experiences on the way to this path was the mentorship and instruction of one of the members of our current board of advisors and our former professor, Dr. Arnhem Week. You can see a picture in the bottom right corner of my slide. And it was in his sustainable food economy course that we began to envision a more thriving Arizona. And Hannah, myself, and our peer Nick Shivka piloted a cooperative food business training program first. So these are a few of the highlights in my story that propelled me forward into Thrive upon my graduation and its launching of its first program for veterans in Phoenix in the summer of 2021. From that time on until now, we've been working toward our collective vision, and we continue to do so and grow day by day. Thank you for listening.
Thank you so much, Huda. And what an amazing story to know that you can take what you learn and put it into a business plan and to create your own consultancy. So looks like it's a growing movement. So thank you for being here. And let's bring back Daphne and Janan for a conversation with all three of you. So come on back, Daphne, come on back, Janan. And oh, someone's getting a phone call. So question for you, I'm going to ask you all some of the same questions, but I want to ask you some individual questions first, because I want to touch on some of the things that you specifically mentioned about what you do. So Janan, back to you. And I think we weren't recording originally when you were speaking, so sorry about that. But Janan does research and is a professor at University of Hawaii, and she was talking a bit about food waste reduction and being able to track and measure food waste. And I was really curious, how do you do that? And how can someone realistically, let's say they're working in a kitchen, they're working in a restaurant, they're working in food service. How does one realistically track food waste? And what did you discover with that research that you were doing?
So I think there's still a lot of work to be done in this area. I have just done some work at the individual level in adolescence, and I used an app that was developed by Dr. Carol Boucher, who is at our University of Hawaii Cancer Center here in collaboration with engineers as well at Purdue University. And this app allows for tracking of waste at the individual level, and it involves taking a picture of the plate before eating and then after as well. So we can look at what is left on the plate. And then we further asked questions about what happened to the food that was left on that plate, whether people saved the food for later or threw it away or fed it to an animal, etc. So it was a study in adolescents, and in this group of adolescents, we found that actually there wasn't too much food waste. So it was a relatively high income population, and a lot of the kids were bringing food from home, so they weren't necessarily consuming the school lunch. So in our study, we found that there wasn't a huge amount of waste, but of course, we know that there is a lot of waste, particularly at schools amongst children. So this is an area of interest, and there's a lot more work to be done in this area. And I was interested in it because we know from other research that's been done that it's really a big issue, for children and more broadly.
Yeah, and we know that food waste is responsible for, I think, about 8% of greenhouse gases. So it's a fantastic place for us to create amazing change that can have long-lasting effects. So thank you for that. And Daphne, question for you about Meatless Mondays, because when I think of people who are trying to incorporate sustainability into their jobs as nutritionists or as professionals working in the nutrition field, where does Meatless Mondays fit in terms of how to implement it in a way that is successful? I know it can be hard. People think, you're taking away my meat. How can people implement it in a way that you have found to be effective? And what are some strategies you can suggest?
Oh man, so the whole thing, it depends, right? If you trying to incorporating it, so we've done a different things. So since it started really at Hopkins, starting it at a university setting, like as Hopkins, that was a no-brainer. That was different. We have different groups on campus. We had buy-in at that point. We worked with Bon Appetit, who is if you know about their model, if you know about their visions, they're really focused on sustainability, on locally grown foods. They're focused on providing you with the best, freshest food that they can be provided. So it was really easy to partner with them to get them to do, do a Meatless Monday. And it wasn't really in your face. It was more or less that here's a meatless option. We had green labels to highlight it. And if it was an option, if the students decided they wanted, it wasn't, but the other options were still presented to them. As a dietitian working with, individually, when you're trying to do Meatless Monday, I always say when we're doing, that was another panel. I said, if you want somebody to not eat meat, don't tell them not to eat meat. Because what you're doing is telling them to eat meat, because nobody wants to be told what to do, right? I don't want you to tell me what to do, because somehow I don't know why we think that's just horrible. But what we find to be successful strategies that have worked, it says, well, as opposed to doing this, eating this, you can substitute it with that. We're not saying not to do it. It's just the language in which you use and the type of marketing ploy you use it. Why don't you switch this for this? Why don't you add this? So we always say add, add the legumes, add the beans, just add that to your plate and make the meat, small, or just, we don't tell them not to do anything. We talk about substitution and adding, and we know that's strategies that have worked. One thing that's really amazing about Meatless Monday that we realize other organizations have done is that they don't call it Meatless Monday, because somehow Meatless Monday make people think you have to go meatless. It's really not what, it's just one day a week, cut out meat. That's really what we're saying. So they have gone and said, they call it Meat-Free Mondays. They've called it, sustainable. In France, it's called something different. In Mexico, it's something different, but they don't use it because different cultures are different, right? And so, and we find that too, health is a very successful, strategy, not necessarily the planet and climate, depending where they are. But for those that are heavy meat eaters, focusing on health factors, get them to consider it.
Yeah. Great. Thank you. I think that will be helpful for people to hear who are trying to implement this and are either not having success or finding it difficult sometimes. And on that front, I want to talk, Huda, about barriers. You are a consultant. You have this organization that is helping businesses to work on sustainability, whether that's around food or other ecosystems. And I'm curious, what kind of barriers do you come up against from people with whom you're working, and how do you work through those barriers?
One of the biggest, just looking like more big picture, one of the biggest barriers ties to the reason why we really are doing the workshops, the ecosystem development workshops, in conjunction with our training capacity building programs. And that is that once people graduate from the programs, they might have, the capacity to try to start up their own sustainable cooperative food business, but there really isn't a supportive ecosystem to accept them in terms of like the cooperative specific financing or banking institutions, in terms of, just the awareness of the different, like the corporation commission, and like the knowledge that's available online in terms of resources. to increase awareness about those things. And so that's what we're really trying to push for in conjunction with, providing the capacity building, but then also building out the local ecosystem.
Mhm. Great, thank you. And a question for all of you, because I think, the people who come on these webinars are eager to know, gosh, how can I get involved? It sounds like, the majority of you, there's been a personal experience. There's been learning from your own culture. There has been learning from family members. There has been watching people in communities where you are from experience improved health because of eating locally or getting back to the land. What are some things that people who are entering into this profession, how can they either tap into their own resources, their own culture, or what educational resources do you think are helpful for people who want to move more into this field of sustainability?
Okay, I can kind of, start a couple of things. What I do with the students at Howard University, I include that in part of my lectures when I'm doing community nutrition. When I talk about that, I really include that in my lectures. And when I'm talking about, food as a whole, when I'm going to the life cycle, I just trying to, a lot of people don't know. I was reading, there was a study, I'm not really sure, oh God, who did it, but they asked about what do you know about sustainability? We realized most people don't know anything about sustainability. If they knew what it was, they would do it. But if somebody is looking, I say to, do some of this work, first, if you're a dietitian, the Academy has a group, interest group that you actually can join, and that's really, do that type of work. I mean, there are organizations like, Mary and Bretta, like Planetary Health, they have a lot of resources. And I will say a lot of the schools, a lot of procurement, depending what type of work that you do. If you say the word or start describing it, you will realize that they're doing the work. They just don't know what it's called. They don't know it's part of it, right? Because sustainability is just not, the food you need to people. Is, there's an agriculture component, there's a social factors component, there's there's just so many different, facets, that comes into play. And when you really, if you break it down, you actually can see, where do I contribute? What can I do? And I will do a plug for dietitians. You went to school and spent a lot of time learning, and you know the evidence, the science. It may be just a course that Mary talked about, it may be the book by Ronnie. There are so many things out there that you can do. You are the expert. Do not let somebody tell you that you're not, because there are a lot of people right now that are playing dietitians, that are playing experts, that they're not. So you have to trust yourself and make space for yourself.
Absolutely. Yeah, we have expertise. We can bring that knowledge and background into any conversation about sustainability. Thank you, Daphne. Janan or Huda?
I could add to that. I think those are great suggestions, just in terms of generally learning about what we mean when we talk about sustainable eating. And along those lines, I'll say that at the last Food and Nutrition Conference and Expo online, I was part of a panel, and it was a discussion around this topic of what is a sustainable diet. And essentially, one of the main messages is, it's quite hard to define. And at this point, we really don't have good guidance in terms of how to talk about sustainable eating. And we need a lot more work in this area to really understand all the facets of it. So I think it's great that this point came up here as well. So I would say that that's a good resource. I think you can still access the recording for that. It was a useful discussion on the general topic of sustainable eating and how we should start thinking about it, because we have a long way to go.
Yeah, and there's a sustainability track now at FENCI. So that's a good news, good movement. Huda, one thought from you.
Yeah, just something really simple for those looking to get involved in their local sustainable food economy. I would just recommend to seek out cooperative food businesses or cooperatives in your area, and along with the seventh cooperative principle, which is, or I think it's the sixth cooperative principle, cooperation amongst cooperatives, you'll notice that cooperative owners tend to be very open and welcoming and willing to share knowledge and resources. So it's a very good place to go to just get involved in the local food economy.
And when you say food cooperatives, are you talking about grocery stores that act as cooperatives, that kind of place?
So it could be grocery stores, but it could be also any cooperative across the food system. So on like anything from production, which could be like farming, processing, distribution, even waste, or like recycling, food recycling. So any cooperative business across the spectrum. So when I mentioned processing, could be like bakeries or even local restaurants, just anything.
Excellent. I've got some questions from our participants. One has said, do you have any tips for dietitians who want to help educate the general public and start the conversation on this topic? I know the new graduate degree requirement for future dietitians limits how many are able to obtain this credential, and would love to help the public access this type of information. Any thoughts from you all on that?
Around the topic of sustainable eating, right? That's what the question refers
I
to.
believe it is, yeah. Just
Okay.
educating the general public.
Yeah, and I would say that, one of the things we talked about in FENCI is the fact that we really don't have, a good grasp of how exactly to define a sustainable diet when we think of all the different facets of sustainable eating, and how that looks different really for different populations given their particular circumstance, and where their food comes from and their cultural preferences. And there are many considerations when it comes to what sustainable eating looks like for a particular group of people. So I would say that right now we really don't have good guidance as to how to educate the public on this topic. Other than really to stimulate the public to start thinking about those various facets of sustainability so that they can start to define a sustainable diet in their particular circumstance.
Great. Yeah, it does vary so deeply from region to region, person to person, place to place. Another question, unless somebody else had a thought about that. This is a really interesting question, which is, can a dietitian implement nutrition education through agriculture? She says, or this person says, they're troubled by farmers aging out, and they're wondering if school gardens and community gardens can influence youth to consider the job while they are learning to eat and grow healthy. Thoughts about that, and perhaps relating that to policy change? I see some thumbs up from our participants.
I think you can. I'm trying to figure out, and I'll find it, Mary, and I'll send it to you. But there's a video that we have actually on, I think on CLF's YouTube channel, where it talks about just different individuals where the youths can actually go, you can apply to a program where you go for the summer, but you actually learn for that reason, given that farmers are aging out, you basically go and learn from, you learn kind of just everything, how to plant, how to crop, everything you need to know, but more or less about regenerative agriculture as well. They're really focused on that, but I have to find it. But something like that exists. There's a group that is actually focused specifically on that the farmers are aging out, and how do we attract youth, to do it. And part of the reason is that when you think about farming, it's not lucrative, but also they're not treated fairly, right? You got to think about that equitable piece. They don't have a lot of money. They work hard. There are a lot of, they get signed into those contracts where they get stuck in them to produce, and they don't really get paid. So when I think from a policy perspective, there needs to be some investment done. There needs to be investment in the land, investment in resources to kind of make it, provide people with land. Land access. I mean, there's just not, the field is not very equitable around the board. It's not really meant for local and regional farmers to really grow and flourish. And I think if you can just try to do some investment in this people and provide resources, I think you'll be surprised how many children, kids will get involved. And if you're talking about inner cities, depending where you're going, or rural areas, specifically out in the cities, I've had children that really, I mean, I hate to say this, that from an education standpoint, don't really understand. They think the peaches is only in the can on them little thing, right? And so they get really excited about being able to grow their own food. My kids get excited about that. Getting excitement out of them, but you got to start young, right? Someone who is my age is not going to find it amazing and lucrative, because it's really, you know, right now as it stands, it's not.
Yeah, and hopefully that will change too with the farm bill that's coming up in
Just about to bring
2023.
that up. Yep, and we signed up.
Yeah.
We have a really good and we can, again, I can share this later, but we do have we did get rid of food policy councils, where we really actually send for the White House. I don't know if you guys are familiar with the White House conference that's coming up in September on hunger and etc. And you know, that is one of the things that we made suggestion on, is that, you know, with the farm bill, you know, they should increase, you know, they should increase the funding for that, for farmers market, for regional food, for partnerships, for all of that. You know, it's very important when you think about farming, you have to talk about the, you know, leveraging economic development as a means for equitable food access and opportunity. And I think the USDA's framework for food system transformation investment, it's a financing project, and you know, it's a collaboration with the Small Business Bureau, with economic oh gosh, I can't remember all the agencies that are part, but they should prioritize the support of retail, of those small community retail shops, you know, where they can partner with local farmers. It just got to make sense. The young people out here, they're not stupid. They're very smart. If it doesn't make sense for them, they're not going to do it, because they know there's nothing in there.
So we need to wrap up here. I wanted to give each one of you an opportunity, and there's so much to be said about this. So thank you for all of the rich information and conversation tonight. I wanted to give each one of you an opportunity to mention one, I repeat, one source. I know we've got people out and in the audience tonight who really want to know, how do I begin to learn more about these things? This source can be your own source, but one source that you feel like has been either a game changer for you or could be really beneficial for others. Again, one source or resource.
I guess I could start. I personally love to listen to podcasts. So I think you can listen to podcasts from lots of different registered dietitians and other professionals to hear their take on sustainable eating.
Great. Huda?
Recently, I've been doing a lot of reading, just like getting into reading a bit more. And I feel like it's a very rich and powerful way, specifically some cooperative specific books that I've been reading so far. I think it's a powerful way to learn about just the whole map of and like network of cooperatives and people that are working towards more sustainable businesses, and a person like a person's whole life just captured in one piece, in a bite-sized version.
Fantastic. Absolutely. We got to learn more about this. Daphne, one thought from you.
Look at your local network, your LinkedIn profile. You'll be surprised what you find there. And you'll be surprised who found you. That's kind of been my story for the last 12 to 18 months.
Amen to that. Same thing. And we are going to be having a foundations course on food and climate here that will begin in January. So keep an eye out for that. Thank you all so much. There's lots of great chats going on in the chat as well. I'm going to let Greta close us out. Thank you to everybody who's joined us tonight, and thanks a lot.
Thank you for the opportunity.
Thank you.
Fantastic. Thank you guys so much for sharing your story and this wealth of information with all of us. I just want to give a huge thank you for everyone who is attending tonight. We hope you guys learned something new. We hope you're inspired, and we hope you have something to take away with you. If you are interested in volunteering with us, please reach out to us at hello@planetaryhealthcollective.org. We are always looking for people who are interested in supporting our mission and just creating projects that are passion projects for you as well. And again, please connect with our speakers. They they all share their contact information with you in the chat. So please connect with them and continue to learn more. And if you guys would like to, in a couple weeks, check out how you can incorporate plant-based diets into clinical nutrition. Come to Bringing Plant-Based to the Plate on October 5th. We would love to see you guys there. There'll be a live cooking demo as well as all the information. So thank you guys so much for joining us tonight, and have a wonderful night.